ERA and AFNET are celebrating 20 years of successful heart research this year. What makes the cooperation special and what are the keys to the successful cooperation?
Well, it makes it special that we have a lot of our history in common. And over the years, we have had many joint meetings, AFNET and ERA. They were always very happy getting together, I would say, but also scientifically at a very high level. Usually they were done at the Heart House in Nice. And it was always centered around the topic, of course, always atrial fibrillation, but looked at it from a different angle. We had all experts there. It was a rather small meeting, so you had the time to talk to everyone. There was a real joint effort atmosphere. And that was extended usually by writing groups on the second day, where some people had to stay a bit longer to compile everything. And usually also a document, a text, an article was finally published. So it was very rewarding in many aspects.
So, looking back over the last 2 decades, what would you say were the greatest achievements? Is there anything you would like to highlight?
Yeah, I think a great achievement is that, for instance, first it started in one country, Germany. Of course, it's a big country, as an initiative bringing different universities together, but it has expanded really all over Europe. And I think it is a very successful story on how bringing together experts and creating an atmosphere of collaboration really caught on, not only in Germany, but really beyond Germany. So I think that was very successful. Of course, the fact that they moved also with AFNET from thinking about research-related matters to also doing research in the sense of clinical trials also is really an example, I think, for the rest of Europe. It's not so many countries that have copied this sort of initiative. So congratulations to AFNET.
Last but not least, looking into the future, what do you envision for the next 20 years?
That's a difficult question. The ideal future would be that within 20 years AFNET was not necessary anymore. That we would have ablated all. That's not what I expect. But that we understand better what is AF, and if you understand it better, that you can also better prevent it and maybe prevent AF from developing and occurring. If that were the ideal future, then AFNET, of course, would not be necessary anymore. But that will not be done in 20 years.
Thank you very much.
You're welcome.